Hello YouTube. Since I do have a health section, I primarily talked about fibromyalgia and chronic fatigue because it's been on my mind and affecting my mind and playing with my mind and my life and my happiness in my mind and my life more than any other health condition that I deal with. But since I already have a health section, I thought I would expand upon that a little bit more and introduce you to another unknown but common. It's under rare conditions, but it's more common than people realize. And often they do not realize they have it unless a family member has already been diagnosed with the condition. And then they get genetically tested and screened. Often they do not know they have this condition until something tragic happens, until they are in a crisis, until they have an aneurysm rupture somewhere in their body, or an organ failure or malfunction crisis due to an aneurysm malfunction in their body. It is actually the leading cause of healthy women, otherwise healthy young women, dying in childbirth due to undiagnosed pulmonary aneurysms, pulmonary being in the lungs, and young people dropping down dead from aneurysms in their brain. It's important to spread the word and the symptoms of this diagnosis because it does exhibit symptoms and it can be caught early, even if you don't have a family history of it, and no one has a family history of the symptoms. If you have some of these symptoms, ask your doctor about the condition. Or if you have some of the key symptoms, ask your doctor about genetic testing for screening for the condition, such as pulmonary, which is your lung, aneurysms, especially if you're discovered to have more than one pulmonary aneurysm. That is a high indication that you have the disorder. I'll go over some other external and extreme epistaxis, recurrent epistaxis, which is nosebleeds, extreme and recurrent nosebleeds. Some people with this condition have such heavy nosebleeds that they end up in the ER and need transfusions. Recurrent anemia. And I will go over some other external manifestations of this disorder so that you know if you should pursue finding out if you need screening, and if you are screened to be positive, it is a dominant heritability, so it will be passed to your children, more than likely. And so everyone in your family and your immediate family should also be screened for the genetic disorder and have the appropriate organ systems screened. This disorder that I am talking about, I have alluded to in the past. It is the reason why I had my lung surgeries. The two surgeries that I had, and had titanium or platinum, I can never remember which one, coils inserted into the arteries in my lungs on both lobes, the branch coming off my heart on this side, and 4 small ones in my lower lung, because I had aneurysms, pulmonary aneurysms. And that is how I wound up getting tested, genetically tested, and verified for the disorder. And I am now hooked up with a specialty treatment clinic designated to treat this condition. When I was first diagnosed, I was told that I would have to go to the Mayo Clinic to find anyone even close that had any kind of specialization in this disorder if I wanted follow-up. But I was recently discovered that there is a clinic closer to me at the University of Michigan Hospital. It's still not close, but it's a lot closer than the Mayo Clinic. And they have a specialty HHT clinic with specialists. The disorder is HHT, Hereditary Hemorrhagic Telangiectasia, also known as Osler-Weber-Rendu disease, Osler-Weber-Rendu syndrome. It is a rare autosomal dominant genetic disorder that leads to abnormal blood vessel formation in the skin, the mucous membranes, which is like your nasal passages and inside your mouth, eyes and other mucous membranes, and often in organs in the body. The ones on your skin and in your mucous membranes are going to be much smaller telangiectasia rather than an AVM. And the ones in your body, in your organs, can vary from small telangiectasia to much larger AVMs. And the AVMs are going to be the ones that are going to cause significant problems. The organ systems that this can affect is the lungs, which I mentioned, pulmonary AVMs, the liver, which can cause bile duct blockage and liver failure unless treated. There used to be no treatment for this because they cannot really operate on the liver without damaging it. But the clinic that I'm seeing has informed me that there are treatments now for and things that they can do should you develop an aneurysm in your liver that they weren't able to do in the past. It is no longer kind of a death sentence to liver failure. Your pulmonary aneurysms, the greatest risk having an undiagnosed pulmonary aneurysm is hematosis, which means bleeding to death in your lungs and drowning in your own lung blood, hemorrhage and hematosis. So that's what happens when young, healthy, otherwise healthy pregnant women go into labor. The pressure of trying to push the baby out and squeezes and the fluctuations in blood pressure burst that aneurysm, and they can bleed to death on the table. If you have pulmonary aneurysms or a history of pulmonary aneurysms, you are also supposed to not fly in planes because the air pressure can cause rupture. You are not supposed to go diving because, again, the pressure changes can cause rupture. You should wear a medical alert bracelet notifying that you have pulmonary aneurysms and a history of pulmonary aneurysms, because although it's only in the movies, by and large, that the bubble in the IV drip is going to come into your lungs and kill you, and people get really freaked out when they see a little bubble coming down. Most people do not have an issue with that. If you have pulmonary aneurysms and these things recur, if you have the genetic disorder over the years, you may get more. So you never know if you have other small, unless you were just screened, again, other small aneurysms growing. So you should wear a medical bracelet that says that, because you need a bubble tap for your IV, and this will stop all the bubbles from entering into you whenever you use an IV for any kind of infusion or saline or anything at that hospital, because tiny air bubbles can travel through the aneurysm in your lungs and go directly into your heart and cause an embolus, go into your brain and cause a stroke. Also a risk of having pulmonary aneurysms, besides rupture and embolus, tiny blood clots, which can also cause rupture and embolus and stroke, is that you can have bacteria go through the aneurysms into your heart and into your brain and cause sepsis and infection. So spleen, brain, skin, which is little telangiectasia, they look like little tiny spider veins, but they're red and not blue, and they're very, very small. And the mucous membranes, recurrent epistaxis because of these telangiectasia in the membrane, and your nose breaking and rupturing and little hemorrhages, bleeding out the gastrointestinal tract because it's membrane and organ. The blood vessels in the intestinal tract can be affected, and you can have can't think of the word, occult bleeding. Some people have like extreme bleeding when they go to the restroom, and that's pretty obvious. But oftentimes what happens with intestinal telangiectasia is that you have, and AVMs, is that you don't have a massive one, you don't have a massive rupture. What you do is you have continuous, slow loss of blood out of your body, and this leads to chronic anemia, and through chronic blood loss, low blood levels, low iron levels, and some people again have it so extreme they need infusions. It can happen in your brain, which I mentioned. Young people with no signs or symptoms collapsing or passing due to an AVM, having to have typically gamma wave radiation, a gamma knife is used, and the damaged veins are ablated, or similar to a lung AVM, a coil is placed to block off the abnormal blood flow, and so that blood doesn't enter the aneurysm area. And eventually what happens when you stop the blood circulation is it shrinks and dies, and like damming up a river, eventually the blood will stop trying to go to that area and will divert to other proper channels in the body where it is supposed to go to begin with. Untreated brain and AVMs, unaware brain AVMs, are one of the biggest dangers of hereditary hemorrhagic telangiectasia. And lastly, your spinal cord. So you could be walking around one day and suddenly you fall and you can't stand up. You can't walk and you don't know what's going on. Or you have movement, it appears that you have some sort of movement or gait disturbance or that type of a disease, and in fact it is the circulation in your spinal column is disrupted by an aneurysm, which is also very dangerous. Telangiectasia are small vascular malformations. They typically occur in the mucous membranes, like inside the nose and in the gastrointestinal tract. I will include a telangiectasia. This is what a telangiectasia looks like. This is also a picture of my telangiectasia, visible telangiectasia. It affects my chest area, which is not the most common place that you're going to recognize them. I have a few on my face, but mostly on my chest area. It's not the most common place for HHT, but I have a random HHT variant, so mine is a little atypical in its course. Typically in the ones in the GI tract and which is your intestines, and your nose is going to cause bleeding, sometimes more profuse. The bleeding typically begins in childhood, especially with the nosebleeds. About 40 to 50% of people have recurrent nosebleeds, some of which can get so bad, again, they need transfusions. Intestinal bleeds tend to be slow, occult, and lead to anemias, and you may not be aware that you are losing blood in your intestinal tract. The ones on the skin, sometimes there are spots, which I do not have any, but I will show a picture of affected fingertips and feet. There are also spots on your mouth, in the mucous membranes, and inside the mouth, sores and blisters inside the mouth, which are actually ruptured blood vessels, because this is a body-wide genetic disorder, miswiring. And so the superficial misconnections create these little telangiectasias in various parts of your body. And by and large, they're insignificant. The ones inside your mouth, sorry for the outside noise, inside your mouth and lips and things like that are, and skin are far less likely to bleed or break, but they can just be aesthetically displeasing to people. Mine are very minor. Again, I will show you a picture of my chest telangiectasia and my lip telangiectasia, and I have had recurrent anemia of unknown origin, so we don't really quite know what's going on with my intestinal tract. I have to follow up on that. But it affects typically like 90% of people with HHT. The skin lesions appear suddenly, with the number increasing over time, typically in sun-exposed areas. I wear a lot of tank tops, have over my life. My chest is very burnt and very exposed, and that kind of makes sense. Only about 20% are affected by digestive tract issues, so that is less common manifestation of HHT. I hit the wrong button. Made it stop right. Alright, AVM is a much larger vascular malformation. The AVM I had in my lungs, the doctor said he could fit his 2 fingers in there. And it is a vein. It is not meant to be that big. What happens in AVMs is it is a poor vein artery connection that is not meant to be there. The most common areas affected are the lungs, the brain, and the spinal cord. I kind of ran around already the effects of having it in your lungs, bacterial infections, drowning in your own lung blood from hemorrhaging to death, strokes, blood clots, heart attack, sepsis, bacterial infections, bubble embolisms, etc. Clearly, and stroke, if I didn't mention that. If you have them in your brain, stroke, brain hemorrhage, death, same with here, sudden death, sudden hemorrhage, their stroke, you may begin to have seizures or other signs that give you an indication that something may be amiss, and it turns out that you have an AVM. but sometimes they don't come with symptoms. Sometimes they come without warning. But you may have symptoms reminiscent of stroke-like symptoms ahead of time. If you ever experience the worst headache of your life, go to an emergency room immediately. In the liver, you can have ascites. I don't know how to pronounce this. Ascites. I don't know. It's when your body fills up, your chest cavity, your abdomen cavity fills up with fluid. You're backed up with bile. You have cirrhosis and bile duct blockage. Hepatic encephalopathy, and cirrhosis and liver failure. Again, really not good to have these things undiagnosed. Telangiectasia of the membranes, mucous membranes, recurrent epistaxis, which is recurrent nosebleeds, especially if they're heavy, especially if they've been going on for years, recurrent anemias because you could have a GI tract issue. You might want to check into hereditary hemorrhagic telangiectasia. Really bad time to mow. I also want to link to HHT.org that has far more information on this disorder. And once you get a diagnosis, go to a specialty clinic. It is important that you get all of your organ systems all of the organ systems that this disease can affect: brain, lungs, liver, spinal cord, and intestines, carefully examined through an angiogram, embolism test, colonoscopy, endoscopy, with them being informed to be looking for aneurysms and telangiectasia and internal bleeding, because you have this disorder, specifically seeking out any internal bleeding in your intestines, and screening your brain and your entire body for blood clots and aneurysms. And you will have to do this at least one time to make sure everything is good. And then from there, your specialist, if you have some of these symptoms, you think you might have HHT, you could be referred to a genetic clinic where they will test you for HHT. If you're determined to have HHT, or if you have aneurysms, plus some of these other symptoms, bring up HHT, get yourself to an HHT center, or if you have a relative with HHT, get yourself to an HHT center, because it can kill you, but it's all treatable. It's all treatable if you get in front of it, but you have to get in front of it. And it causes otherwise healthy people who don't know they have a ticking time bomb inside their body to die. And because it's dominantly inheritable, you give it to your siblings, can all have it. Your parents can have it. And it typically is at full expression by the 40th year, by the 4th decade of life, it starts to peak. So you have this ticking time bomb and you look fine and you feel fine, and then, well, bam. And some people get into their 80s before it starts to show itself, and some people die at 20. So once you have indications you might have this, it's really important to get screened. It's really important, if you do test positive, that you find a specialist who knows how to treat the condition so that you can be properly screened in every organ system, and they will tell you based on your results what follow-up you need, how frequently you need to come in and be screened again, annually, biannually, every 5 years, whatever their determination is. And everyone in your family that is your immediate relative or has symptoms also needs to be screened for this disorder. It will save lives. For you to find out if you have this, because if you have this, your immediate relatives most likely have it, and if they don't have it, they carry it, and they can pass it to their children who may have it. So it's important that you find out if you have some of these symptoms, that you get to the bottom of this, and find out more about the disorder. So I will connect you to HHT.org. They have a lot of information there, and they are research. They do raise funds for more research and studies, and they have live web seminars where you can learn more about specific issues that you may be dealing with. That's where I went to find out more about my pulmonary aneurysms and the treatment and embolization and all of that. So that is hereditary hemorrhagic telangiectasia. Again, I'm going to, as I said, I'm going to show you AVM, telangiectasia, explain a little more about what they are, link to hht.org, and yeah, those are my primary symptoms at this point, is that I have a little minor examples on my skin and in my mucous membrane. That may be the cause of my chronic recurrent anemia. I have a colonoscopy scheduled for next year to follow up. I think in February, it's early. And I just got done with my angiogram, and everything looks good. No new aneurysms. I had 5 taken care of in my lungs, 4 little ones and 1 big one. And everything in my brain looks fine, except I have in my frontal lobes, apparently, what appears to be small telangiectasia malformations. They're referring me to neurology for a further look to see if that's something we need to keep track of in the future or not. Or if it's just fine and it's just a little bleed and we're good. Cares, I'm bleeding in my brain. I got cysts and tumors in there too, who cares? It is what it is. But it is important to spread the word about this little known disease, because what you think is nothing, you have a lot of nosebleeds and they can be pretty heavy, and you've had them since childhood and you just don't think much of it. And what you don't know can kill you, and kill your mom, and kill your grandma, and kill your kids. And so I want to get the word out there about this a little bit more. Hereditary hemorrhagic telangiectasia. Osler, I can't remember the name again. Osler-Weber-Rendu. Osler-Weber-Rendu disease. An AVM is an abnormal connection between arteries and veins. These can get big because arteries are supposed to hold heavy blood flow and veins are supposed to hold little blood flow. And when you put high pressure and a lot of volume into a tiny vein, it gets bigger and bigger and bigger and bigger and bigger, and that is why it eventually ruptures and hemorrhage occurs. And because the connection is not filtered properly through the appropriate channels, just a high flow is just going straight through. That is why bacteria, bubbles, blood clots, etc. can get through and directly into organs and body systems through these abnormal channels in your body. AVMs are large. They can be quite large. As I said, the one in my lungs, I had a vein that was big enough to put 2 fingers in, 2 grown man's fingers. And a Telagiectasia is the same, but it is a very small malformation. It's teeny tiny veins, not big, massive veins. And so should they rupture and bleed, it's not going to be a catastrophic event. So that is a Telagiectasia, and that is an AVM. And this is the link to HHT.org. Hopefully this was somewhat informative, if not quite rambly, covered up by the mower. I was all over the place. I really wanted to do a quality video about this subject, and I feel like I've rambled incessantly about it instead. But maybe I'll get better with time, and hopefully this provides you some information or some resources if you were worried, interested, or oblivious to this important and dangerous condition. Love you guys. Have a good day. Healthcare is self-care. Peace. Love and awareness. Hereditary, hemorrhagic, Telagiectasia. Look it up. Love you guys. Bye, too.